uh, Dr. Dr. Vishnu Agarwal has been pretty modest with his CV, and after Berger having introduced all that he did, there's nothing much really left for me to say. Suffice it to say that Dr. Vishnu Agarwal, as Berger mentioned, he's a consultant robotic oncosurgeon. He's attached to Jaslok, Saifee and Bhaktivedant Hospital. His main expertise is offering robotic surgery for cancer patients, for which he's specially trained in France and South Korea. And his training in cancer surgery has been at Tata Memorial. He's the first surgeon in India to do robotic surgery for breast tumors. He has done a maximum number of robotic surgeries for oral cancer in South Mumbai. He has extensive expertise and experience in laparoscopic as well as robotic surgery for Gynaec and colorectal cancers. The advantage of robotic surgery, as probably many of us are aware, is that there is minimal blood loss, higher precision, minimal pain, faster recovery, lesser complications, and the minimum scars. Dr. Agarwal has experience of more than 15 years, and he's operated more than 5,000 patients from India and abroad. He's, in fact, does a lot of charity treatment for the poor patients. So let's look forward to hearing him now. Thank you.
Thank you, sir, for a nice introduction. Thanks. And I deeply thank all the esteemed guests who have taken out their valuable time to share this topic. So presently, I will be presenting. Basically, we know that now COVID is going on, and that is the hot topic which is going on. But still, the cancer is still prevalent so much. So I will be discussing on cancer. So our first motive is to because 70 to 80% of cancers are preventable actually. Only 20% of cancers are there which are not in our hand actually speaking. So 70 to 80% cancer are preventable. So we should know that what are the factors which we can change in our life so that we can avoid, and also we can teach other people whom we are influencing that how you can prevent. Suppose there are workers who are working under us, so we can tell them that how you can prevent the cancer. So my main topic will be how to prevent cancer and what are the factors which lead to the cancer. And another topic is very important also because as we know traditionally the cancer surgeries, the main treatment for cancer is for solid tumors mainly is surgery followed by chemotherapy, radiation as and when required. So, but we know that traditionally how mutilating the cancer surgeries have been, so big cuts and incisions and patients are there in the hospital for so long. ICU and many things, so with the advance of technology, now the robotic surgery has come in place where the recovery is very fast, the cuts are very small, and the patient can return to his normal activities within a week or 2 weeks maximum. So this is the advantages of robotic surgery. So my topic will be first how to prevent the cancer, and secondly what are the advantages of robotic surgery in various fields like urology and colorectal cancers, gynecological cancers, oral cancers. So that I will show it in the later part. So now I'll begin with my presentation. And I'll be sharing the screen. So there any comments or questions we can take in the later part of after completing this presentation. So first, as we all know, what is cancer? Because there are many myths about cancer that it is caused by some infection or it is communicable, but it is not like that. Cancer is actually our cells only which show uncontrolled growth. Normally, the cells in our body are controlled, so they grow and they become big and then they die. But the cancer cells are which grow and they outgrow the normal cells and they do not die. There is no normal apoptosis. What is called apoptosis means death of the cells. There is no death of the cancer cells. That is why they grow and they form a tumor and then they spread to other part of the organs. So we must have heard that we call whether it is a malignant tumor or it is a benign tumors, because tumors are like the some swelling taking place anywhere. So it may be benign or it may be malignant. Malignant means cancer, whereas benign means normal, means it will not spread to other part of the body, and it is not dangerous. And we can just, if it is causing problem, we can just remove that tumor, and then it's enough. There is no need of further chemotherapy or radiation or something. These are benign tumors, so there's nothing to worry about the benign tumors. What we are worried about is the malignant tumors. Malignant tumors, why we are worried? Because they do not stay at one place. They go to other places also, and they destroy other organs also. So that is where we are worried about. So when we say cancer, it is malignant. So cancer cells reproduce every 2 to 6 weeks. Sorry. So what are the main factors for cancer actually? So as I spoke, 70 to 80% of the cancers are preventable. So there are mainly 3 factors which we can divide. One is lifestyle, our lifestyle, how we are living, what we are eating. This makes a lot of difference. And then environment. So we know that how the environment is getting polluted and everything is polluted outside. So that is another cause. That is why the cancer incidence is increasing day by day. And third is family history. So many people think that cancer is genetic. Always it runs in families, but it is not like that. Only a very minor amount, like 10 to 15% of the cancers are family history oriented, means genetic, inherited. Most of the other cancers are because of the genes, the mutation of the genes already present inside the body, which are not hereditary. And that mutation of the genes may be caused by lifestyle, by environment, or just like that. So there are like auto mutation, which is not caused by some. So those constitute around 20 to 30% of the cancers where we don't know. Sometimes we say that we are living a very normal life, eating a very healthy food. Our lifestyle is good. We don't have any family history. Then why I have got the cancer? So that still the science cannot make out that why, even after doing all these things, why there is cancer. So there are 20-30% chances that there may be cancer without even having all these factors. So as I just told, so in India actually we see the tobacco is in the world over also, but India tobacco in the chewing form, chewable tobacco, that is the main cause of cancer. Actually 30 to 40% of the cancers in India is totally preventable if we just quit tobacco. If the tobacco is totally banned, even illegally it is banned, then we can avoid 30 to 40% of the cancers in India. And other countries, it is tobacco in the form of smoke, which is the main cause of lung cancer. So, and the diet is a very important part. I'll just show in another slide also what diet is important. Then infection. Some infections like hepatitis B, hepatitis C can cause liver cancers. And occupation, people who are working in the industries where a lot of smoke exposure is there, or some chemicals can cause cancer. Others are sun and radiation, alcohol, pollution, medicine, food additives, and gender. Gender means some cancers are more prone in females and some are more prone in males, which we cannot change. So these are some causes of the cancer, which I already explained. I'll not go into details again. So what are the lifestyle risks? I have already told that smoking is one of the main cause, smoking or tobacco chewing. Then diet. Diet is very important. Nowadays, a lot of junk food is being eaten outside. So that causes high fat intake, and high fat intake or obesity is one of the causes for some cancer. Like in females, the females who are having high fat diet and obese females have more prone to get breast cancers and endometrial cancers, ovarian cancers. So these are more common in females. And the males also, like colorectal cancers, are more common in people who are taking a lot of meat in their diet. Because of it is high fat diet, it is not digested properly. So that is also another cause of colorectal cancer. That's why colorectal cancers are more common in Western countries like US and Korea. When I was trained in Korea, the colorectal cancer was one of the main cancers there. So in that hospital, 3 operations that are simultaneously running for colorectal cancer. So that these are the dietary factors. And environmental factors, smoking, not only active smoking, we have heard what is passive smoking. Even if a child is there who is living near you and you are smoking, So that will cause effect on him also. So that is called passive smoking. So that itself can be a cause of cancer in future. In hereditary, so as I told, less than 15% of the cancers are inherited. And what are the cancers which are hereditary? And it is not always like breast cancer can be hereditary, but most of the breast cancers are not hereditary. Similarly, colon cancers, ovarian cancer, prostate cancer, they may be hereditary, but most of them are non-hereditary. So it is not that in a family somebody having cancer, so it is always that their relatives will definitely have cancer. Very less chances of them having cancer, but still can have. Just it's a small slide showing what are the signs. So depends on which organ is affected. Suppose there is a cancer in the oral cavity, so there will be ulcer which is not healing, or there is a cancer in the colon or rectum, so patient may have abnormal bowel habits, maybe diarrhea or maybe constipation for a long time, which is not. So these symptoms can happen in other diseases also, but it is not always pointing. So it is nothing to be frightened or worried that, oh, I don't have normal bowel. So that is maybe one of the cause. Similarly, skin cancer may having some wart or mole on the skin, or lung cancer patients may have chronic cough which is not subsiding, and there will be some blood coming out of the sputum. So these are some signs which may be there, which may not always be there in the patients in early stages. So these are some of the common cancers. So just in brief, so I have already discussed unbalanced diet, smoking, alcohol, and chronic infections like HIV virus and this hepatitis B virus or HPV virus for cervical cancer. So these are one of the main causes of cancer in people. So in just what are the preventable factors? Main thing is lifestyle change. So avoiding junk food and avoiding a lot of like food which is even fruits and vegetables what we eat are not organic in true sense in most of the times. So that is also one of the most important. If we can got organic foods, that will be best, because a lot of chemicals are there in these foods and then they cause cancer. And alcohol intake should be reduced as much as possible, because more alcohol intake for a longer period of time can lead to liver cancers. Definitely smoking is more dangerous actually, and a lot of cancers can be caused, not only lung cancer but bladder and oral cancers and pharyngeal cancers are due to smoking. So avoiding all these, and physical activity. The physical activity is very important, and I will recommend that physical activity. Most of the people, what they do is they do some gym, and they will do exercises in the gym where there is no exposure to fresh air, and they take a lot of proteins. And believe me, you all know that there will be many deaths in the last, I have seen so many years, the patients dying in the gym itself, because they overdo something which is not natural for their body, and that causes stress on the heart. And then, so better we do exercises in the morning time, fresh air, lot of breathing exercises, pranayam. These exercises are very important, rather than going to gym and just burn out and all those things. But that I will not recommend. So that is very important. So these are the main things, and occupational environmental exposures we can avoid. So whatever we can do because we know that there are many things in this world we cannot change, because it is out of our control. But whatever we can do from our end, we should do to prevent. And these things are not only for cancer actually, even for heart diseases, for other diseases, all these factors apply. Physical activity, avoiding obesity, reducing occupation, so many diseases are because of not doing these things. So it just doesn't apply only to cancer. So a lot of fruits and vegetables in our diet actually decreases cancer risk, but try to get organic foods, and they should be truly organic, because many times people say that they are organic but they are not. So whatever possible we should do. And there are some cancers in which we can do screening also, regular screening, like for colon cancer in US and Korea, they have a very strict screening protocol that every 3 years they will do a colonoscopy to see if because they have a lot of colon cancers. So in India is not so prevalent, so we may not do for colon cancer, but for breast cancer and cervical cancer, we can do screening. It is very simple. For breast cancer, patients can do self-examinations, just to palpate the breast and see whether there is any lump on a regular basis. And after 50 years, they can undergo mammography once in 3 years to see if there is any early lesion. For cervical cancer, it's very easy, just gynecological examination and for pap smear if needed, to be advised by the gynecologist. And for males, very common is a prostate cancer. So prostate cancer is a very slow growing cancer, so not much to worry in the initial part. But if there is any urinary problems, suppose increased frequency of urine is there or urgency of urine, you cannot control the urine, then so in that case we can just consult a urologist and get a serum PSA done, which is a marker for the prostate cancer. So these are the screening tests. Why screening tests are important? Because we can screen the cancer and we can detect the cancer in early stage. Because most important thing in the treatment of cancer and the success of the treatment is not the always the treatment what we are receiving. It is the stage at which we are diagnosed the cancer. If we can diagnose the cancer at an early stage, earlier the stage we are diagnosed, the less is the treatment, the less the morbid is the treatment, and the recovery is fast and the prognosis is very good and patient can live the whole life. So it is not that cancer is a dead end. Cancer is not a dead end. There is a treatments available, but we can detect it at early stage. So this was my presentation for how to prevent cancer and how can detect cancer at an early stage. Now I'll be going in the treatment. So as I discussed, suppose somebody gets a cancer, then because patients are frightened by the treatment itself, but can we have something in which we can definitely avoid morbidity, hospital stay, pain to the patients? So that is where the minimal invasive surgery has come into a place. Minimal invasive surgery, up till now we also were doing laparoscopic surgery, but the higher version of laparoscopic surgery is robotic surgery. So I will be describing what is robotic surgery, and I will be playing some videos also in between, so that we can get an idea how the robotic surgery is useful in many cancers. So first video I will play our introduction to robotic surgery.
This animation is brought to you by the Smart Image Base.
Robotic surgery is a minimally invasive operation performed by surgeons.
Doctor, it's not visible to us.
It's not visible? Sorry.
Yes.
Called
Just a minute.
Getting only the audio.
Yeah.
You should share both the audio and the video.
Yeah. The video
Now can, yeah. Is it visible now?
Yeah. Yeah.
Yes, you can start from the beginning and the bottom. Yeah.
Robotic surgery is a minimally invasive operation performed by surgeons manipulating robotic arms through several tiny incisions called ports. A robotic surgical machine consists of several main components, including the console, where the surgeon sits while performing the operation, the patient's side cart with 4 interactive robotic arms and attached surgical instruments, and a high-definition 3D vision system. This system allows surgeons to make precise, controlled movements in your body with increased vision and dexterity. During robotic surgery, your surgeon will insert a high-definition 3D camera through one of the ports. The camera provides a magnified view of the surgical area. Then your surgeon will insert specialized surgical tools held by the remaining robotic arms through the other ports. Seated at the computer console, your surgeon will view the surgical area through a viewfinder and move the surgical tools and camera with joystick-like controls and foot pedals. Your surgeon's motions will generate computer input to guide the motion of the robot arms and surgical tools. Advantages of the system include controlled, accurate movement of the surgical tools, prevention of unintentional handshake or tremor, ability to operate in spaces smaller than a human hand, enhanced visibility of the surgical area, and less patient blood loss and scarring.
Yeah, so this was just an introductory video. I will explain again. So what is robotic surgery? Actually, it's not that robot is independently doing the surgery. Everything is under the control of the surgeon. But I will just show you what are the components of the robotic surgery actually. If you can see this, this is the normal operation theater. This is the robotic arms. And this is a table on which the patient lies. And this is the surgeon which is sitting on a console. And whatever he guides, that movements will be translated in these instruments, and these instruments will perform the surgery. But everything, surgeon is sitting and seeing whatever is going on inside the body, and then again accordingly he is manipulating the instruments from here. There are two hand pieces here which he is manipulating, which I will show you in the next slides also, and according to the instruments will be moving. So this is a vision in which the surgeon sees, and when the surgeon is seeing, the vision is three-dimensional vision. Normally in laparoscopic surgery it's a two-dimensional vision, but in this it is like purely three-dimensional vision. So very clear vision, and just even the small vessels or small arteries, veins will look very big, and you cannot do an error in this robotic surgery. And another advantage is that surgeons, when they grow old, they may develop tremors in the hands. But when we do through robotic surgery, these tremors will be filtered, and they are not translated into the instruments. So the instruments remain steady, although there may be tremors in the hands of the surgeon. And the degree of freedom of movements of the instruments is more than the hands. Even the hands may not reach to such places in the abdomen cavity where the robotic instruments can do those tasks. See how the fine the instruments, these are the instruments which operate. So very fine instruments and very less chances of doing any error. And this is the two cameras together which gives a three-dimensional view. See how the degree of freedom of movements of the hands have the limited degree of freedom of movement, but these instruments have more than 9 degrees of freedom of movement. So they can move in any direction. So this is the operation theater, typical operation theater. When many people ask that surgeon can sit in America and operate here. Yes, he can do that, but there should be some surgeon sitting in the operation theater also, because suppose some complications happens, so the surgeon has to be there to control that. So it's not, he can guide the surgeon sitting in another country or can guide this surgeon, because they can be connected. These two surgeons can be connected together through the internet. So they can guide him, and then he performs, or even if he performs, he has to be there. So like that, and they then whatever they do in this console, the movements, the same movements will be translated into this. And this is sister nurse who can change the instruments, whatever instruments has to be required. And this is an assistant. So there are only 3 people required in the operation theater. Normally in laparoscopic surgery, there are 7-8 people are required in the operation theater, because everything is manual there. But here everything is under the control of robot. And the surgeon can control everything. It is like driving a car. He can control the clutch also. He can control the brake also, steering also, everything. So everything is under the control of the surgeon who is sitting in this console. So I'll just play 2-3 videos more to give a more idea. What are the advantages of robotic surgery?
The advantages that we found with robotic surgery are, first and foremost, is that these patients have less blood loss. They're in the hospital for a much shorter period of time, and they have much fewer needs in terms of narcotics for pain control postoperatively. Remarkably, no matter how many small incisions that you place on the abdomen, the recovery and the pain and the entire postoperative experience is dramatically improved for the patient as compared to one long, big incision. And that's mainly because when we're using these robotic trocars that we're placing into the abdomen, they essentially make a very, very small defect in the abdominal wall, and that translates into a lot less pain. The other huge benefit of robotic surgery is actually the instrumentation and the degree of precision and the degree of dexterity that we get manipulating these instruments, utilizing what are called surgical actuators, which are actually the controllers that control the instruments in the patient's body. In gynecologic surgery, we're working in a very small space, which is the female pelvis. And so it's hard sometimes to work your way around there with conventional laparoscopic instrumentation. But what we found with robotic instrumentation now, which is wristed and actually has more degrees of freedom than the human hand, is that especially for very precise procedures such as lymphadenectomy or removing lymph nodes off of vessels deep in the pelvis, we can get very, very close and zoom in on the field of view and use these instruments to our advantage because they're wristed and they can move many different ways, and we can get down into a very tight space and do very meticulous surgery.
एक चीज कभी कभी इमेज बिगाड़ सकती है, इसीलिए कोडैडी प्रोफेशनल इमेज ताकि बिजनेस
Next slide. So as we see, the robotic surgery is much faster than conventional surgery. This is also very important for the surgeons also, because in this surgeons are also very comfortable as they can sit on the table or on the chair and operate. Whereas in cancer surgeries, because they're long surgeries, so they also feel fatigued, and then they can create some error because of the fatigue. But because now the surgeon is sitting comfortably and operating, so the error fatigue is not there, so surgeon can concentrate more on the steps of the surgery. So even it increases the margin of error for the surgeons also. And about the cost, so definitely robotic surgery is a little costly because this robot itself is a costly investment for the hospital, and not many hospitals have this robotic facility. Plus the instruments of the robot, which you saw in the slides, they are also costly. So around 1.5 lakh, 1 to 1.5 lakh is an extra cost compared to a conventional surgery. But when we compare the recovery time and the comfort of the patient and the clarity of the vision and the error, the less chances of error, all these factors, if we combine, then definitely one may go for this thing, considering other factors. Another very important thing, we know that how the oral cancers, which are caused by tobacco, the surgeries for oral cancers are very mutilating because they destroy the face totally. You may have seen also many patients that how they are after surgery, their faces get totally mutilated, and so the robotic surgery is playing a role in this. I have done maximum robotic surgery for head and neck cancers in South Mumbai, as sir told, and what we do is normally when we do surgery for oral cancer, we take the incision here in front. But when we do for robotic surgery, we can take the incision behind the ear, and there will be no scar seen in the front. So we have done the surgery, but there is no scars seen. So that gives a lot of this cosmetic outcome to the patient, or good cosmetic outcome to the patient, and the confidence. And many patients, I'll just show you the video. One of my patients' video, who were operated by CA tongue, and now hardly anybody can make out that the patient is operated. This is I am sitting in the operating the with the robot, and I'll just show you a final video. This video is a testimonial of one of my patients who I operated for CA tongue, and she is just sharing her experience.
I was diagnosed with oral cancer. Hi, my name is Vishnu Agarwal, and I was diagnosed with oral cancer almost 2 years back. It was difficult to accept initially as the cause was constant friction of food on my tongue, leading to grade 2 carcinoma. Fortunately, we happened to meet Dr. Vishnu Agarwal for the treatment, and it was indeed one of the best decisions we made. Dr. Vishnu Agarwal's comforting words and understanding of the illness and confidence in treating the surgery gave us much relief and made us easy to accept the procedure. I was recommended to go for the robotic surgery based on various merits like incision, accuracy, out of view scar, less blood loss, etc. We got operated in Jaslok Hospital robotically with neck dissection, and everything went well as planned by Dr. Vishnu Agarwal, and I'm happy to share that the surgery was successful. Best part was the choice of robotic surgery, as recovery was indeed very fast, and I was discharged within 5 days. Here I am after 2 years. Actually, no one can make out I was ever operated for a major cancer surgery. After life is very normal for me, and the past is gone. I have no issues with the speech, and I'm living a normal life, my daily routine. And thanks once again to Dr. Vishnu Agarwal for the moral support and giving us another reason to continue fighting with this illness. So let's join our hand together against cancer, and we will win for sure.
नमस्कार दोस्तों, मैं आज आपसे गुजारिश करने वाला हूँ। एक छोटी सी बच्ची, जिसका नाम मना है,
Yeah, so this was a patient of CA tongue. She was having a cancer in the tongue, small early cancer. So robotic surgery for oral cancer is only for early stages. When it's a small tumor, then you can do. But if it is advanced cancer, we cannot do robotic surgery. So she underwent excision of that lesion in the tongue, and we always do a neck dissection. Means we remove the lymph nodes from the neck. So normally there is a big scar in the neck seen, but because we did robotic, there was a scar behind the ear, which was covered by our hair. So we cannot see any scar here in this patient. So that is one case. So like open surgery is like riding a bike, laparoscopic surgery is like driving a car, and robotic surgery is flying a plane. So this is a different. Surgery is the same, but the approach is different, and the recovery and the post-operative factors are totally different. So thank you very much for patient hearing. So this was I wanted to present. Any questions or any comments, I will be most happy to answer. Thank you very much.
Thank you so much, Doctor. I was amazed at the easy way you put the whole presentation and made it so simple for us to understand. In fact, I was just going to sort of suggest to you that the people here want a sort of presentation which will be easy for them to grasp, and I think you sort of immediately guessed it. I think it was so well presented and so well thought out, and I think what is most important are these various myths which we have in our mind. Yes. And you very, very succinctly explained to us what is required. I mean, we do read a lot of information overload, but I think you very, very beautifully put it. I am particularly impressed, especially in the way you spoke about doing this. I can make out that you're not only an experienced surgeon, but a humble human being. And I was I was very, very impressed when I heard that you also do free surgeries, which I think is a fantastic thing. As you must be knowing, in Rotary, our particular club, I just very briefly mentioned, we do a Little Hearts project where we do free surgery for babies who have a heart congenital defect, absolutely free of cost for underprivileged people, and also our cataract project. We do free cataract surgeries. In fact, 4 of our surgeons who are in the club itself operate, and we are totally free for underprivileged people.
Very nice, sir.
I think, Doctor, thank you so much for a very fantastic presentation. I will now request the members who I'm sure will have questions for you to ask some questions to you.
Thank you, sir. Thank you for appreciating, sir. Thanks a lot.
Can I, Barjo?
Please.
Doctor, I am Rohit Patel.
Good morning, sir. Good afternoon, sir.
Good afternoon. I suffered from prostate cancer.
Okay, sir.
I never had a genetic history or anything. What is the reason for my getting prostate cancer? What could be my reason? Though it was detected very early due to regular PSA test.
Yes, sir.
Many. Can you tell me the reason of prostate?
Sir, that's what I told in the presentation also, that there are many cancers in which still we don't know that still we don't know what is the causes of cancer. So like oral cancers, we know that it is tobacco chewing, but prostate cancer, still there is no answer to why one gets or not. Still there is no answer, sir. So best thing is to detect it early as you did it, and regular examination, PSA test, and prostate cancer is a very good cancer to have, in the sense it is completely curable, and the relapse rates are hardly any, and just keep our close follow-up. That's all, sir.
Yeah, I was told by my doctor that if God says that you are going to get cancer, and which cancer I shall give you, then you should ask for prostate cancer.
Yeah, you're right. You're right.
And doctor, I am running a kidney hospital at a place called Nadiyad, my hometown. And we have got a robot, and we do prostate cancer, kidney transplant, all by the robotic way.
Very nice, sir. Very nice to hear that. Thank you.
Thank you. Thank you very much.
You.
Yes, sir. Members, questions? Yeah, please ask.
Doctor, I'll ask a question. So, obviously the cost is a big element over here for patients wanting to take a call whether to go for a, regular surgery or a laparoscopy or robotic.
Yes, yes.
But,
yes.
Where is a tipping point, in the sense, where does it make sense despite the cost to go for robotic rather than a regular surgery? Because it's substantially more expensive than the regular surgery. That's what I understand.
So what do you want to know, sir? I didn't get it.
No, in the sense, in a surgery, how does one make a call whether to go in for a robotic because cost is an element.
Yeah. So as I explained, sir, there are 3 kinds, like open surgery, laparoscopic, and robotic. So the difference between open and laparoscopic surgery is not so much, but between the open, laparoscopic, and robotic there is a difference of around 1 lakh. So see, depends on the surgeon's comfort level. If the surgeon is competent enough to do a laparoscopic surgery, because thing is that whenever we can, we should avoid open surgery. That is first thing. Like if we are operating for colon cancer or for rectal cancer. So I am a trained colorectal cancer and Gynaec and Colorectal cancer from South Korea. So since the time I have been trained, I never do open surgery for colon cancer, for endometrial cancer, uterus cancer, because this is like committing a crime actually. And if you ask me, I am not. But when there is a facility available, then the patient can go home in 2 days and 3 days. And why the patient has to undergo so much pain actually? Because open surgery means you have to take a full cut throughout the abdomen, then the healing. My relative got operated many years back in Delhi actually, if an open surgery for endometrial, very early stage. She was in the bed for 2 months actually. Because of the post-op wound infection she developed, she was obese. So I will say that at least if not robotic, the patient should go for laparoscopic surgery. At least for some cancers like endometrial cancer, uterus cancers, colorectal cancers, and prostate cancer, robotic surgery is the gold standard. There is no alternative actually. If you ask me, for prostate cancer, robotic is the gold standard. So no open surgery, no laparoscopic surgery, just go for robotic surgery. But for this colorectal cancers, gynaec cancers, if not robotic, patient cannot afford robotic, then laparoscopically is equally good. So robotic is just a higher version of laparoscopy in one sense. The vision is better. But for the patient, laparoscopy or robotic, both are equally good because both have the keyhole, both are keyhole surgeries. So that is what we should take. If the patient cannot afford robotic, then at least for these type of cancers like colorectal, gynaec, endometrial cancers. For ovarian cancers, open surgery is still the gold standard because ovarian cancers are more sometimes spread, and you have to do a more complete, in the sense other organs you have to take lymph nodes and all those things. So still the gold standard for ovarian cancer is open surgery, but for endometrial uterus cancers and this colorectal cancers, minimal invasive surgery is the gold standard. So one should go for that.
Thank you.
Barjot, can I ask a question?
Please.
Yes.
Yeah, hi doctor. That was an interesting talk.
Thank you, sir.
My question is basically from the surgeon's point of view. Now
Yes, sir.
that you are used to doing your operations through the robot,
yes, sir.
If required to do a regular operation, does that become difficult for the surgeon? Or
yeah, it's a good question. But thing is, sir, only once a person is perfect in open surgeries, then only he can go for a laparoscopic or robotic surgery. Because until unless you are well versed with open surgery and you know that what are the anatomy and you have done some number of cases in that, then it is very easy and it is more perfect and precise when you jump from open surgery to laparoscopic or directly. If you try to go to robotic surgery, you'll not be able to be a good robotic surgeon also, or a good laparoscopic surgeon. Reverse is also true. If we can do laparoscopic surgery nicely, we can do robotic surgery, then open surgery is like a child's play for the people who are doing robotic surgery. That is what my experience is. And definitely it holds true for many others. And there are many places actually where we cannot do laparoscopic or robotics. As I told, that ovarian cancer is there. Suppose a patient comes with ovarian cancer, so I have to do open surgery. There is no option of. So I am not always doing laparoscopic and robotic. I'm also doing open surgeries also, because there are indications for everything. So what are the scientific indications? That only we do. We cannot push the patient for robotic surgery, or we cannot push the patient for laparoscopy. If the indication is for open surgery, then we have to do open surgery. So it's all scientific indication should be there, whatever we are doing. It should not be our own desire based or something.
Thank you, doctor.
Doctor, may I ask a question, please?
Yes, madam, please.
I'd like to know how successful is robotic surgery in case of breast cancer?
So no, the thing is that breast cancer, the role of robotic surgery is very minimal, and in Western countries, people are doing for breast cancer, but the role is very minimal. I did the first in India in Saifee Hospital for it was not cancer only, it was a sarcoma of the breast, and patient was very young and she wanted to preserve her breast actually. So I did that. So the role is very minimal. So presently, as of now, if you ask me, the role is almost nil for breast cancer at present for robotic surgery.
Thank you.
Thank you.
Is there, doctor, a move to, in addition to what you mentioned for robotic surgery and laparoscopic surgery, what about other disciplines like minor orthopedic or minor other things? Is it being explored to go into other disciplines as well, or is it only to the stomach?
No, so it is like robotic surgery. When we say laparoscopic surgery, definitely it is applicable to other disciplines like hernia is there, or laparoscopic gallbladder removal is there. So I will not recommend so much to go for robotic surgery in these branches, because these are anyway very small surgeries like gallbladder removal, hernia, and they can be easily performed by laparoscopy. There is no much advantage of going for robotic in these cases. Unnecessary wasting of money and resources. Robotic surgery is basically designed for complex surgeries like in cancer or more complex surgeries like that.
Okay. Any other questions, members?
Just can I ask one question?
Yes, sure.
Yes,
can it happen in heart surgery as well?
Yes, definitely. So people are now started doing in the US, though definitely they are doing. In Saifee also, hospital also, Dr. Barenwala sir, I think had done recently the minimal invasive robotic surgery, where we don't have to open up the chest at the CABG.
Right.
So people are doing, but still in India it is not very widely done. But outside definitely people are doing, and it will come in India also very soon for heart.
Right. Okay. Thank you.
May I quickly make a comment?
Sure.
Dr. Vishnu, Dr. Prasad Dandekar here. It was a pleasure listening to you, and I'm seeing you after a long time. And let's catch up soon. Thank you very much.
Thank you, sir. Thank you very much.
Sure.
जो मैं ask,
please do.
Somebody sent me a message which I'm asking on this behalf. Which are the places in Bombay where these robotic surgeries take place?
So in Bombay, like South Bombay, if you ask me, so we have in Jaslok Hospital and Saifee we have, HN Reliance they have robot, and these are the three places in South Bombay. In Kokilaben in Andheri, Kokilaben Hospital has, Nanavati Hinduja has robot. So major hospitals do have the robotic facility presently. Tata Hospital also has the robotic facility. These are the main hospitals in Bombay which have.
May I?
Please, Doctor. I will...
Thank you, Mr. Barjat, for arranging this. Such an important, such a informative talk, put in very simple word. And thank you, Anil, for the question which I was interested in. And from the Rotary Club of Bombay Hill South, I want to thank all of you. And may I request that if the recording of this President Berger can be made available so that we can pass it on to other Rotarians of my club who have missed this.
Sure, absolutely. Certainly we'll do that.
Thank you. Thank you.
Are there any other questions from the members or anybody would like to say anything? If not, can I request Aditi Choksi to convey a vote of thanks on behalf of our club as well as the Bombay Hill South.
Thank you so much, Doctor, for taking us into the magical world of robotic surgery.
Thank you, madam.
It really, really looks like magic to me.
Thank you.
And on behalf of the Rotary Club of Midtime, I really want to thank you for giving us such a simple explanation for getting the cancer and doing the surgery. And I hope because of your insight into giving us the reasons for cancer, we'll all listen to our body and do our exercises and control our diet and prevent the cancer if possible. Thank you so much. Thank you.
Thanks a lot, madam. Thanks a lot. And I really thank from my heart to give me a chance to speak. Actually, I thank Mr. Ratnan sir and Mr. Manoj Jalan sir who gave us
Sir, I'm interrupting. Doctor, I'm interrupting you. Don't use the word sir. We are your friend and your colleague. So,
sir, we are all seniors.
Seniority is something different, but the colleague and the friendship is more important. And what I request you to do join with the Rotary for the projects and thing at as President Berger has told that they are doing so many things for the needy people and other thing like that. We are also doing. Actually, in fact, Rotary Club of Midtown is our father club. They have sponsored our club, Rotary Club of Bombay Hill South. So we are very thankful of the Rotary Club of Midtown to give the opportunity. And I am also thankful to my colleague Manoj Jalan, who has just asked me on Sunday that whether Dr. Vishnu Agarwal may be available for his talk on Wednesday. So I had done some fruitful job, and people, the members has got benefited. I have got many friends in the Midtown, like my colleague co-president R.K. Anand in 15-16, my co-president Sucharita in 16-17, Manoj is already there. Nalin Shah having the Lotus Eye Hospital, who was managing our Pali Hospital, and Anil Kamath ji and many others. So doctors request यही है क्या आप रोटरी को किस तरह से आप सहायता कर सकते हैं, बेनिफिट कर सकते हैं, ताकि जो रियली नीडेड सोसाइटी है, नीडेड पीपल है, उनको सहायता मिल सके. एंड फ्रीली फ्रैंकली स्पीकिंग इन अ सिंगल लाइन क्या हम लोग हाथ जोड़ के पैसा लेते हैं लोगों से, हम लोग डब्बा लेके जाते हैं कि भाई प्लीज डोनेट फॉर अ गुड कॉज. So like that we are also requesting you, I am requesting on behalf of this audience that please support Rotary movement. हम लोग पैसा नहीं दे सकते हैं लेकिन we can generate the contacts and other thing. और पैसे के लिए भी ऐसा कुछ नहीं का नहीं दे सकते हैं, थोड़ा बहुत जैसा भी है उतना हम लोग मैनेज करते हैं. So please, as you are situated in the South Mumbai Kenilworth में रहते हैं, पेडर रोड में, so we will have a more frequent meeting and we will request you and ask your support and we need your commitment. So thanks a lot, doctor. Thanks, Dr. Vishnu.
It's a good opportunity, sir, for me also to express my also feelings and do some good work for the society. So I will also look forward to it, that how can we associate and do some good thing for the society. Thanks a lot for the opportunity.
Thank you so much, doctor.
Thank you.